There are many aspects of practice that are important in establishing, maintaining, and upholding professionalism in dermal therapy. Professional and personal integrity is the foundation of these elements. Consistently working to the standards of best practice, maintaining a commitment to duty of care, and operating within the defined scope of practice are vital professional attributes. Adherence to these elements ensures the success and advancement of the dermal clinician in clinical practice. The scenario presented here deals with uncertainties in the scope of practice for the dermal clinician. A client requests that the dermal clinician removes a small lesion. The professional and negligent approach to this will be illustrated using the 3 key points often encountered in everyday clinical practice.
Meet Suzie, our dermal clinician. She demonstrates professional practice when dealing with her clients. On the right are Suzie's alter egos, bad clinicians. They demonstrate a distinct lack of professionalism, misrepresentation, and a failure in duty of care. Note Suzie's outstanding professionalism as she deals with her clients in the 3 following scenarios.
I'm Suzie, it's nice to meet you.
Likewise, Suzie.
How can I help you today?
I'm just here because I have this lesion on my arm and I was just wondering, are you able to remove it?
Okay, so what we'll need to do here is we need to go through a really thorough consultation.
Yeah.
I've got some forms here that I'll get you to fill out for me.
Yep.
After that, I will take you through to the treatment room and I'll give it a really good look and we'll assess it and we can take it from there.
Okay. Well, I've actually been to a dermatologist previously, and he's removed it before. But I can't get in with him for another month. Can't you just do it now for me?
Okay, so you've already seen your doctor.
Yes, yeah.
And what did they say?
It actually was a cancerous lesion.
Okay.
Yeah.
So because it's a cancerous lesion, unfortunately I'm unable to treat that for you today.
Yeah.
And I'd really recommend that you go back to your doctor and that you get some clearance. So a letter of approval would be fantastic.
You can't just remove it now for me?
Unfortunately, I can't. If we were to treat it, say with a laser or some type of machinery, it could mask any other symptoms and that could be a detriment to your health.
Okay.
Thorough consultation ensures informing clients of the possible risks, explaining of treatment limitations, and ultimately obtaining informed consent from the client. Completing a thorough consultation is not only legally prudent, but also gains the client's confidence and trust in the clinician. Adequate consultation allows the client time to ask questions and seek guidance. By identifying contraindications, the clinician can ensure that care is taken to minimise the risk of harm to the client. This protocol maintains a high standard in professional practice and avoids any legal claim of trespass. Duty to warn is the provision of relevant information regarding potential risks and complications of treatment. A failure to fully explain these risks is an act of negligence. Informing the client of the limitations of dermal practice is also important.
I noticed that you're a dermal clinician. Is that similar to like a skin specialist, a dermatologist?
No, they're quite different.
Okay, but I noticed that you're a member of the Australian Society of Dermal Clinicians. Isn't that similar to being registered as a health practitioner?
I am a member of the ASDC, but it's an organisation. It's not a registered medical practitioner. They're very different.
But wouldn't it just be easier if you diagnose and treat this lesion now, here?
So if you've been to your dermatologist or your GP and they've diagnosed it, then I can certainly treat the symptoms, but I cannot diagnose or treat, just the symptoms.
Okay.
Holding out as a health practitioner or as a medical practitioner are both illegal and immoral. Implying that you are a medical practitioner or that you are affiliated in any way with the medical profession when you are not is considered holding out. This may be stated, referred, indicated or implied in a number of ways, either directly or indirectly. Holding out not only lacks integrity but also places your client at risk. Dermal therapy is not a registered profession. The Australian Society of Dermal Clinicians is a membership organisation only. This is significantly different in legal terms to a professional organisation that provides registration. You cannot claim that you are a registered professional if you are a member of the ASDC. Unregistered practitioners may not be prosecuted by health law, but are held accountable by other areas of law and can be sued and disciplined with these. The use of a protected title is illegal. Protected titles, names of professions that are specifically protected by national law, must not be used by anyone who does not hold official registration with the controlling professional body. Examples of titles that are legally protected are medical practitioner, occupational therapist, nurse practitioner, and many more. Dermal clinicians are qualified to treat the symptoms of a disorder or disease, such as inflammation or edema, but they cannot treat the specific disease or disorder itself. A medical practitioner is the only profession legally qualified and registered to diagnose and treat. The term specialist, such as skin specialist, dermal specialist, or laser specialist, must not be used at any time in reference to a dermal clinician. This term is restricted for use in the medical profession and must not be used in a way that could imply the dermal clinician has medical expertise or qualifications.
you?
Hi, Di. How you going?
Not too bad. Look, I'm just in a bit of a hurry at the moment, and I was just wondering, are you able to remove this lesion for me?
Okay, what we'll need to do is we'll need to go through a thorough consultation. Firstly, I'll get you to fill out some forms for me, and then we can give it a really good assessment before we go any further.
Can't you just do the small lesion now? Is it really necessary that I have to fill out all these forms?
Absolutely, it's non-negotiable. I must have you filling out these forms. I need every detail. It's non-negotiable.
I haven't seen my GP as yet about the lesion, but should that be a problem? Should it be okay just to still go ahead?
That's a big problem, and we absolutely need clearance from your doctor, so I'd really recommend that you go and visit him or her before we can go any further.
Okay.
Negligence is the harm that is conducted as a result of a decline in standards of behaviour established by law as a protection against unreasonable risk of harm. Negligence is deemed when there was a duty of care owed by a clinician and this was breached, resulting in the client suffering injury. This injury should have been a foreseeable result of the clinician's breach of duty of care. These elements would be considered in a court of law in a case of negligence. Negligence can arise from a lack of thorough and accurate documentation. This includes records kept from the initial consultation and all subsequent interaction. Professional records identify evidence of care, include progress notes, and illustrate appropriate decision making in regard to future care and treatments. Complete documentation is imperative in the case of potential legal investigation or review. The professional dermal clinician is able to identify circumstances outside of their scope of practice and refer the client on to an appropriate medical practitioner. Best practice ensures the delivery of a safe treatment after written medical clearance.
Maintaining and upholding professionalism as a dermal clinician is achieved by ensuring the highest standards of professional and personal integrity. This can be accomplished by conducting safe treatments that are definitively within our scope of practice. Dermal clinicians attain this through a thorough consultation, the completion of appropriate documentation, identification of contraindications, and referral to a relevant medical practitioner must also be discussed and documented. Not adhering to these standards of practice compromises the client's health and well-being and places them at risk. Negligence and failure to uphold the duty of care can also result in legal action. Removal of a lesion falls well outside the boundary of safe, ethical, and legal diligent practice for a dermal clinician.
Hi, I'm Shelley. I'm Amelia. I'm Suzie. I'm Diane. This is our presentation for Group 11 for Dermal Professional Practice 2015. Enjoy. Take 3,000.